Hello, everyone, and thank you for joining us today. My name is Brian Howard. I'm a Legislative Associate with the National Congress of American Indians. I will also be your webinar administrator for today. On behalf of NCAI and the Universal Service Administrative Company, I'd like to thank you for attending this presentation to provide an overview of the Universal Service Fund's Lifeline program. Before we begin the presentation, I'd like to go over some of our webinar features. First, you should see on your screen the PowerPoint for today's presentation. If during the presentation you experience any lag in slide transition, it may be a result of internet connections, so just give it a few extra seconds to update on your screen. Currently, with the exception of panelists, all audience phone lines are muted until conclusion of the presentation, but if you would like to ask a question, you can type it in the questions box on your webinar control panel. After the presentation, we will have a Q&A session, and panelists will answer questions submitted through the questions box. But if you would like to ask your question over the phone line, please use the raise hand option so we can unmute your phone line after the presentation. Also, our webinar software archives all questions submitted through the questions box, so if we are unable to answer or address your question, we will follow up with you after the webinar is concluded. And finally, this webinar is being recorded so that we can share this presentation with you and others not able to attend today. Now that we've covered some of the webinar features, I'd like to introduce Mr. Nathan Kim, Program Analyst for the Lifeline Program at the Universal Service Administrative Company.
Thanks, Brian. Thank you for having us. It's our pleasure to be here with you all today and spend this time with you informing you of the Lifeline program. Again, my name is Nathan Kim. I'm an analyst with Lifeline at the Universal Service Administrative Company, otherwise known as USAC, here in Washington, D.C. And joining me on the call today is Michelle Garber, Vice President of Lifeline, who will also be available to answer questions during the Q&A portion of our presentation. But before we begin, I'm going to turn it over to Jessica Zuffolo, our Senior Advisor here, for some opening remarks. Jessica?
Thank you so much, Nathan, and thank you for participating, all of you, in today's webinar to learn about how the Federal Lifeline Program can support internet connectivity across Indian country. We're very, very honored to have a chance to talk to you all this morning in some of your states and this afternoon in some others. We are very committed to making sure that universal service connectivity is available to every Native family, school, hospital, library, and consumer in all of your respective territories. We care deeply about making sure that the spirit and meaning of universal service is something that really is deployed and a reality for every Native consumer across all states, all 56 states and territories, as well as just in every Native nation. So I wanted to say that to the extent that any one of you have specific broadband needs, which I know every Native nation has, affordability is a massive challenge. Internet digital inclusion is a challenge. Understanding and utilizing broadband access to carry and communicate not just among your families and your communities, but also to advance Native programming, Native content. We here at USAC understand all of that since we oversee all 4 universal service programs. Prior to coming to here at USAC, I worked for USDA Rural Development, and the learnings there are being applied here to really expand and make broadband access affordable and as widely available to every Native consumer across this country. So we wanted to restate our commitment to the work of all of you, of NCAI, and our partners everywhere. We want to make sure that this is not the first time we speak with you, and certainly not the last. We are willing and eager to go to your communities and provide technical assistance. We know how important that is for you to learn specifically how to use the mechanisms that we have available to advance economic development and the quality of life for all of you. So we wanted to thank you again for your time, for your indulgence. We look forward to having an ongoing discussion and really a successful endeavor in making Lifeline a reality across every Native nation that's on the bridge and that's represented by NCAI and others. To the extent that you want to follow up with any one of us, clearly you can, and certainly connect with Brian to get us aware of specific questions you may have after the webinar. So with that, I will turn it back to Nate, and again, just wanted to say thank you for giving us the opportunity to partner with all of you.
Thanks, Jessica. If we could go to the next slide. So I'm sure some of you have heard of the Lifeline program. Many people think of it as the free cell phone program. Some people know of it more by the branding done by carriers such as Assurance, SafeLink, among others. Ultimately, we want to tell you more about the Lifeline program, how it came to be, and how it works. A couple of the goals for me today is to inform you and take your questions while creating a dialogue between our organizations. We want to work with you to bring awareness to the Lifeline program and try to ensure that this benefit reaches all eligible consumers. Since 1985, the Lifeline program has provided a discount on phone service to qualifying low-income consumers to ensure that all residents of America have the opportunities and security that phone service offers. It's available to low-income consumers on tribal lands and in every state, territory, and commonwealth. The Lifeline program is one of 4 programs that administer the Universal Service Fund. These 4 programs are the High Cost Program, which provides support to qualifying telephone companies that serve high-cost areas, helping make phone service affordable for the residents of these regions. The Rural Healthcare Program, which allows rural healthcare providers to pay rates for monthly telephone as well as other connection charges to initiate telephone service. The Schools and Libraries Program, also known as E-Rate, which provides telecommunication services and internet access to eligible schools and libraries. And finally, the Low Income Program, of which Lifeline is a part of, that assists low-income customers by helping to pay for monthly telephone and soon-to-be broadband charges. The idea of universal service was established in the belief that all Americans should have access to a baseline level of telecommunication service. As such, it works to promote quality services at just, reasonable, and affordable rates, increase access to telecommunication services, advance the availability of these services to all consumers across all geographical classifications, increase access and services in schools, libraries, and rural healthcare facilities, and is funded completely through equitable and non-discriminatory contributions from all service providers. USAC's role in universal service is as the permanent administrator of the fund and its 4 programs. We were established by the Telecommunications Act of 1996 and are an independent, not-for-profit corporation designated by the Federal Communications Commission. We are not a government contractor or a government agency. Rather, we're a private company that's identified in the FCC's rules and orders as the administrator of the Lifeline program. Furthermore, we work as a partner with the FCC to protect the integrity of universal service through informing and educating our program audiences, collecting and distributing contributions to the USF, and through the promotion of program compliance. Next slide, please. There are 3 key rules when thinking about the Lifeline program, and these rules are in place to protect the integrity of the program. The first is the Lifeline benefit is available only to subscribers who can document their eligibility. Second, only one benefit is permitted per household. In this case, the definition of a household is anyone living at an address, including children, relatives, or people not related to the subscriber, who share an income or household expenses. Lastly, subscribers have an obligation to recertify their eligibility every year. Subscribers must verify that they remain eligible to participate in the Lifeline program once each calendar year. Because telephone subscribership levels on tribal lands are some of the lowest in the country, enhanced Lifeline benefits are available to eligible residents who live on tribal land. This includes those who live on federally recognized Indian tribes, reservations, pueblos, and colonies, residents on former reservations in Oklahoma, consumers within an Indian allotment, or an Alaska Native region established by the Alaska Claims Settlement Act, or even on Hawaiian homelands. Another federal benefit program, LinkUp, further reduces the initial installation or activation fees of certain telephone providers offering service on tribal lands. The Lifeline benefit provides a monthly discount of up to $34.25 off the cost of telephone service, either home phone service or cell phone, and soon broadband. Currently, around 90% of our subscribers choose to apply their benefit to their cell phone service. This monthly discount is currently $9.25 plus up to an additional $25, which is only available to eligible subscribers residing on tribal land. This discount may vary somewhat from state to state, depending on whether it has a state-subsidized Lifeline benefit in addition to the federal component. By last count, there are about 17 states that offered an additional state Lifeline benefit in addition to the federal subsidy. Again, federal rules prohibit qualifying consumers from receiving more than one Lifeline service at a time. Subscribers who qualify may receive a Lifeline discount on either a home or wireless telephone service, but may not receive a Lifeline discount on both services at the same time, and only one Lifeline service may be obtained per household. Lifeline support is also available to eligible subscribers living in group living facilities. Lifeline applicants may demonstrate when initially enrolling in the program that any other Lifeline recipients residing at their residential address are part of a separate household. Go to the next slide. So on March 31st, 2016, the FCC adopted reforms to the program in an effort to modernize it. A few of the big changes are the inclusion of broadband and the establishment of minimum service standards. So beginning on or after December 1st, 2016, and that depends on TRA approval, subscribers can choose to apply their Lifeline discount to fixed or mobile broadband. As I mentioned earlier, Lifeline subscribers can currently only apply their discount to voice services, and that's either their home phone or their cell phone. This change to include broadband was adopted to ensure that Lifeline subscribers could afford 21st century broadband and the access it provides to jobs, education, and other opportunities. This will also help connect all Americans to the internet and close some of the homework gap that exists for households with school-aged children with no access to the internet. But we'll come back to that in a bit. Also, the order establishes minimum service standards. For instance, by December 1st, 2016, Lifeline service providers must offer a minimum of 500 voice minutes or 500 megabytes of mobile broadband or 10:1 speeds with 150 gigabytes of monthly usage for fixed broadband. These standards will gradually increase for the next 6 years while the voice-only offering is eventually phased out. This is important to ensure that Lifeline subscribers are receiving a product or offering similar to what's available on the market now, and that they are not receiving a subpar product. Our website contains more detailed information regarding this, so please visit when you get a chance. Another major change is the streamlining of the eligible programs. this change was adopted to primarily increase efficiency and improve the overall program for consumers, carriers, and other participants. More details will be provided later on in the presentation. Finally, the order calls for the creation of a national Lifeline eligibility verifier. The main goal of the verifier is to reduce the administrative burden and cost to carriers while facilitating consumer choice and to ease the enrollment process for the consumer. Currently, subscriber eligibility is determined in a number of different ways depending on existing state processes. National Verifier will determine all subscriber eligibility in the future, and we hope it will lower the cost of conducting verifications for the carriers while also mitigating the risk of ineligible consumers. Next slide, please. As I alluded to earlier, the Lifeline benefit provides a monthly discount of $9.25 for eligible subscribers. Again, for consumers residing on tribal lands, the monthly benefit can be up to $34.25 per month, and currently, this discount can only be applied to either home or mobile phone service. Beginning around December 1st, the discount may be applied to either fixed voice, mobile voice, fixed or mobile broadband, or a bundle of voice and broadband services. The minimum service standards adopted in the recent order allows for unlimited minutes for a home phone and a minimum of 500 minutes per month for cell phone service. For broadband, a minimum of 10.1 download-upload speeds must be offered with a usage allowance of 500 megabytes per month for mobile and 150 gigabytes for home broadband. Voice-only support will gradually be phased out by December 2021, but until then, the number of minutes will increase to 750 per month by December 2017 and 1,000 minutes per month beginning December 2018 until the eventual phase out in 2021. Next slide, please. So this slide illustrates the second big change from the order, the streamlining of eligible programs. The new list of programs include Medicaid, SNAP, SSI, Federal Public Housing Assistance, Veterans Pension and Survivors Benefit, and income-based eligibility for subscribers at or below 135% of the federal poverty guidelines. We did not list the programs that are going away. We wanted to provide you with a forward-looking list that's going to be effective around December 1 of this year. For your reference, the programs that are being removed from the eligibility criteria are Low-Income Home Energy Assistance, or LIHEAP, the National School Lunch Program, Temporary Assistance for Needy Families, or TANF. We will be conducting outreach and education to ensure everyone is aware of these upcoming changes. Tribal residents that are enrolled in one of the programs above are automatically eligible for a Lifeline program benefit. In addition, tribal residents participating in the Bureau of Indian Affairs General Assistance, Head Start, Tribal Temporary Assistance for Needy Families, Tribal TANF, or the Food Distribution Program on Indian Reservations program is eligible for Lifeline. The changes to the list of eligible programs, again, will take effect on December 1, 2016, or 60 days after PRA approval. So until that date, consumers may continue to enroll in the Lifeline program, even under one of the programs that are going away. I want to take this opportunity to mention that signing up for the Lifeline program is easy. Basically, if you participate in one of these programs, you're automatically eligible for a Lifeline benefit. All you need to do is demonstrate your participation in one of these programs, contact the Lifeline carrier, and ask to be enrolled in the program. Next slide. So this slide gives you an idea of how the process works today. In today's environment, the consumer goes to the Lifeline carrier of their choice and applies for the benefit. The carrier then is responsible to verify that the consumer is eligible, and if they are, enroll them in the program. We are aware that carrier processes vary, but the rules state that the carrier must be certain of the subscriber's eligibility before enrolling them. Once enrolled, the carrier begins providing the discounted monthly service to the subscriber, and the carrier is reimbursed for those services by USAC. Now, just to be clear, the monthly discount is not provided directly to the subscriber. Rather, the carrier provides the discounted service and is in turn reimbursed by USAC. In most cases, the service provided results in the subscriber paying very little, if anything, out of pocket for their service. Once the carrier enrolls the subscriber, USAC conducts an additional check to verify the subscriber's identity, as well as a duplicate check to ensure that he or she does not already have a Lifeline benefit. Now, in the bottom, under the National Verifier model, eligibility determinations will be made by the National Verifier, and once determined, the consumer may decide on the carrier of their choice. The reimbursement process for the carrier will remain the same. As I mentioned in a previous slide, the creation of the National Verifier will work to reduce the administrative burden and cost to carriers while facilitating consumer choice. The key functions of the National Verifier will include determining subscriber eligibility, populating the Lifeline eligibility database, otherwise known as the LED, allowing access to service providers, subscribers, state administrators, as well as acting as the default basis for determining support payments. The National Verifier will utilize data from program databases and subscriber records to make eligibility determinations. Consumers, service providers, and state and tribal administrators will be able to access components of the National Verifier to confirm eligibility, facilitate administration, and reduce waste, fraud, and abuse. The National Verifier will greatly reduce the burden of signing up for the Lifeline program for all stakeholders. It will speed up the enrollment process and make signing up even easier for consumers. Next slide, please. Here's a graphic showing the current Lifeline household participation rate of all eligible households in the U.S. Currently, it stands at 33% nationwide. In order to reach as many eligible households as we can, we are working with partner organizations such as yours to raise awareness and just to get the word out. We found in a lot of cases that people are just not aware that the Lifeline benefit is available to them. We've been working diligently with other eligible programs to provide information, outreach materials, and any other support that we can provide to help reach these eligible consumers. Next slide, please. And here's some more data as it pertains to the current participation in the Lifeline program. As you can see, as of October 2015, there were approximately 13 million households enrolled in the Lifeline program. This data is reflective on all 50 states, the District of Columbia, and Puerto Rico. As you can further see, the vast majority of subscribers enrolled in the program came in with SNAP or Medicaid. Next slide, please. Of particular interest to this audience, this graph shows the Lifeline tribal subscribership as of this past May. There are currently a little over 300,000 tribal subscribers, and interestingly enough, 76% also enrolled in the program through SNAP and Medicaid. Next slide, please. Nationwide, Lifeline participation is at about 1/3 of all eligible households. But here are some current Lifeline enrollment figures from the tribal-specific program. As you can see, there's a low number of Lifeline subscribers that come in through these programs. This is probably due to the fact that these subscribers are using another program such as SNAP or Medicaid as their qualifying criteria. In either case, we want to raise awareness and work with these programs to provide support and letting participants know that when they come in and sign up for, say, Tribal TANF or Head Start, that they are automatically eligible for a Lifeline benefit. Next slide, please. Here's some more high-level data just to further illustrate the current state of tribal subscribership in the Lifeline program. Oklahoma, Arizona, Alaska, and New Mexico account for 93% of the over 300,000 tribal Lifeline subscribers. There are 200 carriers nationwide providing enhanced tribal support, and 80% of all tribal subscribers are served by 10 large carriers. Assist Wireless, Smith Bagley, and Easy Telephone are the top 3 carriers. As a side note, if you'd like to see a list of carriers operating in each state, please visit www.lifelinesupport.org and select the Companies Near Me option in the left-hand navigation pane. This will provide you a list of all the Lifeline service providers operating in every state. Next slide, please. And this is just a graphic showing tribal participation by state. Next slide, please. In conclusion, there are a lot of shared traits between NCAI and the Lifeline program. We share a similar mission in serving households that need access to support and benefits to help make them self-sufficient. As I mentioned earlier, the Lifeline benefit is a critical service that acts as a lifeline for people that keeps them connected to family, jobs, and social services. We hope we can partner with NCAI to promote our shared mission by raising awareness and ultimately increasing accessibility to the Lifeline program for tribal and Native communities. And that brings us to the end of our presentation. I guess we'll open the floor for any questions.
Okay, thank you, Nathan. Again, if you'd like to ask a question, please use the raise the hand option to signal me to unmute your phone line or type your question in the questions box. And while we're waiting for more questions, we did have one question during the presentation regarding the programs that were removed from the eligibility criteria, such as the National School Lunch Program and LIHEAP. The question was, do you have any data indicating what % of Native Americans currently enrolled in those programs would lose eligibility because of those programs being removed?
Hi, this is Michelle. I wanted to say that what we do know, and some of this was illustrated in the data that Nate showed, we know who has used those programs in terms of numbers of people that have used those programs to qualify. You know, as Nate mentioned, 76%, both overall and specific to tribal subscribers, for example, use SNAP and Medicaid to enroll. So we can look at how often people use a school lunch, LIHEAP, to enroll. What we don't know, though, is how many of those people are also in a different qualifying program.
So by having enrolled using school lunch, for example, even with school lunch being removed, that doesn't necessarily mean that the individual or household will lose their benefit. It simply means that they have to now qualify through a different program. And we know there's a lot of overlap in these programs. So we have information about how many people are going to need a little extra help and hand-holding, if you will. You know, imagine us reaching out and saying, you know, in some fashion, us or carriers, you know, this is part of the communication plan we're thinking about, is how to educate people that have enrolled through those eliminated programs that they can no longer continue to qualify using those programs, but to really talk with them about the other programs that continue to qualify people for Lifeline and help them to, you know, if necessary, just update the record to demonstrate that they're actually in SNAP or Medicaid or one of the tribal programs, for example, so that they don't have an interruption in their benefit.
Okay, thank you. All right, while we're waiting for additional questions, I had one question. I know that this kind of comes up frequently, especially in the last couple modernizations and reforms of the Lifeline program from 2012 and this past one, 2016. Could you just explain a little bit more about the definition of the one per household? I know that there's a certain definition that goes along with that. I believe it's that you have to prove you're an economic unit. The reason why I asked that, just for clarification purposes, is because there is a lot of overcrowding in houses in Indian country, and so I was just wondering if you could just expand and explain a little bit more about that, and to ensure that, you know, people that are often mobile or, you know, staying at, you know, different locations over the course of the year, they're still going to be able to be eligible for the Lifeline program.
Certainly. So as Nate mentioned a little bit, the one per household rule is not about your physical address. It's about being a separate economic household. And what that means in the Lifeline program is sharing income and expenses. So if we have, imagine, two individuals who share an address as roommates in order to, manage the living expenses, they may share a physical address. But by being separate people who have separate income and expenses, that they don't operate as an economic unit, then they're considered separate households for the purposes of the Lifeline program, and they can both enroll in the Lifeline program for the discounted service. The way that they do that, Nate mentioned our process at USAC to check for duplicate benefits. So we have a system that each subscriber, when they are attempting to enroll, their carrier will enter their information into USAC's system, and the system will look at the individual's name, identifying information, and address, and it'll alert if it appears to be a duplicate. So because of the one per household rule, the system will recognize if those two individuals live at the same physical address, and it'll alert that this is a potential duplicate. And that is where the consumer can then certify through a self-certifying worksheet called the Independent Economic Household Worksheet that the carrier would provide to them. They could certify that they are, in fact, a separate economic household from the other person at their address. And so that's the process that's used today to identify people, for us to protect the fund from potential duplicates, but then offer that process to accommodate people who are living under the same roof or in a group home or shelter. So that process is used, that independent economic household worksheet is something that all carriers would have available for an individual to certify that their circumstances, are for a separate economic household.
Great, thank you. We do have a couple more questions that came in. First, how will Lifeline subscribers interact with the National Verifier, and is there any requirement that the National Verifier provide native language support? And I'm assuming that means, you know, materials or application sheets that are in native languages.
That is such a great question, and so I will take the first part of that, which was how will
the consumer interacts with the National Verifier. We showed you kind of a before and after slide that had a big, large arrow on it. And one of the things that talked about was that the National Verifier, instead of carriers, will verify eligibility. And that's done potentially in a number of different ways. Today, in many states and territories, the state administrators of programs like Medicaid or SNAP, in many cases, they've made a database available that can be checked against so that a consumer doesn't have to provide a lot of documentation to prove that they participate in those qualifying programs. In other states, a database like that doesn't necessarily exist, so subscribers do provide documentation in order to verify their eligibility. And that will probably still be the case going forward, where there'll be a variety of models in the states, territories, and tribal areas. What the National Verifier aims to do is to work with those groups in order to automate as much as possible the eligibility checking, A, because that will reduce the burden on the subscriber to have to pull a lot of materials together, and B, because we think that provides a greater level of program integrity for the Lifeline Fund. You can imagine that many different types of documents might be presented, and the verifier would have to sort of verify that it's a legitimate document, that it hasn't expired. Whereas if we can go directly to the administrators of these programs and get kind of a yes-no result in an automated fashion, that would be faster, less burdensome to the consumer, and also give us higher confidence in the results. So we're working on a lot of things around that so that as the National Verifier, we can have a really good sort of process in place that works really well in partnership with states, territories, and tribal areas. So that's an important part of our process. Once that's set up, the consumer, we anticipate, might want to interact in a number of different ways. One, there might be an individual who prefers to come and first identify whether or not they're eligible before they shop for service, so to speak. So that person might want to interact directly with the National Verifier, in which case we know it's important to offer several methods for that. So we're thinking about what are the ways a consumer might want to interact to verify their eligibility. It may be that they'd like to come directly to the National Verifier, by calling or mailing some sort of an application in, or maybe they have access to the internet and they'd like to sort of enter in information into a portal. So we're thinking about all those channels that people might be interested in. And again, a lot of this is still being figured out and developed, so I just mean to speak to it kind of notionally at this point as we're thinking through what we need to develop. Another channel might be that the individual has been interacting with a caseworker of some sort in one of the qualifying programs, the other social service programs, and perhaps that program is interested in working with the National Verifier to kind of channel those requests for eligibility through to us in kind of a coordinated enrollment fashion. That might be a model that's used. Or it might be that the consumer already knows what kind of service they'd like to purchase. They already have a particular provider in mind. So they'd like to go to that provider and get signed up kind of all in one step. So not have to do eligibility first and then go shop for service. Maybe they want to go straight to the provider. So that might be another channel, is for the provider to be able to sort of enable the consumer to submit the information necessary to check eligibility. So I say this just to show that we're sensitive to the many different ways that consumers may want to interact through this process. And we realize some of that has to do with an individual person's preference, or some of it might just be what people are used to in the way that they interact today with other organizations that are supporting them. So we want to leave a lot of flexibility there. But to your question about how the National Verifier will address languages, the various languages and tribal languages in particular, that's very important to us. And I think one thing that could be really helpful is for us to learn more from you all about the different languages that are important to be providing materials in, so that we're sure that we have not, missed a really important group for whom, English or some other language wouldn't be sufficient to communicate with them. So I think that would be a great follow-up item for us to work with you all on, is if we could kind of collect or get a sense of the languages that are important in your different sort of regional or tribal nations so that we can target the languages used to be most effective and not assume, sort of one letter with, 2 to 3 different languages on it is going to suffice. So that was a very long answer, but that was a really, really thoughtful question. So thank you for that.
All right, thank you. We do have one question that's going to come in over the phone line. Kathleen Vance, go ahead.
Oh, I was trying to type in then. But my question, I guess, was when it was mentioned about documents, verifying whether documents were current. I thought that if, say, for instance, someone was on the nutrition assistance program, that they could be on there within the year and not necessarily at that point?
So in order to qualify, you have to be participating in one of the qualifying programs at the time of your enrollment. But once you're enrolled, then your recertification only happens annually. But at the time you enroll, everything would need to be current to enroll in the Lifeline program. The issue of documentation really kind of gets back to the challenges with a paper process, which is always just more limiting in some ways than being able to go to the source, right? So to the program administrator of SNAP or nutrition assistance, for example, and kind of get the best sort of real time, if you will, answer to that question, because you do need to be actively participating in one of the qualifying programs at the time of enrollment.
Okay, then I have another question. It was mentioned about Head Start, and so I know Head Start is based, I guess, the enrollment on income, I think, and then like out here, what happens if they don't have enough children that are enrolled, then they open that up for anybody to enroll their children. So it's actually the first ones are based on income, then the second ones is just opened up to if there's any openings left for the classrooms. So is that, even though like Lifeline is based on income guidelines, would that still be okay, just that they're enrolled? That's the main thing, is that they're enrolled, somebody in the family is enrolled in Head Start?
I think that, so you've raised something that I wasn't aware of, and so I think that's an important question for us to take a look at. But the way the rules are written is that participation in those programs qualifies someone for the Lifeline benefit. So, my 90% answer here is that those families would be eligible. But I do think that's something we can just take a closer look at to make sure, go back and kind of look and see if our federal Lifeline rules address that at all, just so we're sure we get you a 100% certain answer.
And Kathleen, this is Jessica. What I would like for you to do is, when we get to, I believe one of the slides shows the contact information for Michelle or Nate. If you would be so kind as to just email us so we can get back to you directly and help you with that answer. I think it might have been, I'm not sure where that slide is, but we really want to connect with you on this. So please reach out to us. There it is. Thank you.
Okay.
Thank you so much. Yes. Okay. And that goes for everybody on this webinar. Feel free to contact us directly with some of these questions because they're really helpful. We really want to drill down on how to expand enrollment in the Lifeline subsidy for Native consumers. You're all automatically eligible. The entire state of Alaska is eligible, but those on the lower 48, really are eligible. And when we talk about states, please know that we're not, insensitive to the issue that Native nations are not represented by states. So we're very much aware of that.
All right, thank you.
Thank you, Kathleen. That was a great question.
Yeah, and so I know that Sue Hutchinson also submitted a question, but she has her hand raised, so I'll go ahead and unmute your line. Go ahead, Sue.
Hi, thank you. I'm wondering if there is some sort of an appeal process for those who have been disqualified due to perhaps a program not being continued, such as the school lunch program. Is there an appeal process for the subscriber?
So those changes were made by the Federal Communication Commission's rulemaking, and so forgive me, I know that there are methods for petitions to be filed after rulemaking comes out. I don't have that information in front of me right here. That's something that we can follow up with you about if you, it's not really like an individual appeal process. It's more petitioning for reconsideration of the rulemaking itself. So the change to the eligibility program was made through rulemaking, and so that's a slightly different process than an appeal might be, but I can certainly get you more information about that. Does that,
great.
Yeah, so maybe what we can do, Brian, I want to make sure that I get the contact information for, I think you said it was, so I want to make sure we can get back to her.
Yeah, well, I'll go ahead and share the contact info after the webinar is concluded.
Thank you.
And then we did have another question come in over the questions box. This goes back to the one per household verification and the independent economic worksheet. Is that something that's being implemented now, or how long has that been around?
That's not new. That's not new with the changes that we're talking about today, that many of which become effective in December. That process was implemented, I believe it was through the 2012 reform order. And so that's been in place for a number of years already. What we will do with that process, as well as other enrollment processes, is as we stand up the National Verifier, which now that I'm thinking about it, I want to clarify timing on that. I want to just be really crisp. So Nate talked about the inclusion of broadband and the changed eligibility programs, both of which changed December 1st of this year. The National Verifier, on the other hand, is a much bigger endeavor to get stood up. So that will be phased in over a number of years, and the first sort of iteration of the National Verifier is scheduled to be up and running at the end of 2017. So about 18 months from now. So I just want to clarify that for people that might have been thinking about that December date. But as the National Verifier, one of the things that we'll be looking at among really all enrollment processes is the independent economic household process. Because as with any of these processes, we have an opportunity to take a look and see how the National Verifier can make the enrollment experience as easy and streamlined as possible. So, one of the things that we'll look at is, kind of revisiting different forms or worksheets that may need to be improved to make processes really clear and easy for those who are trying to enroll. But the process already exists, and if anyone goes to a carrier to sign up today, that process should be made available to them if they need it.
Okay, thank you. I'm not seeing any additional questions coming in at this time. Is there anything else you wanted to address?
So this is Michelle again. I just want to say, for example, the question about languages spoken when interacting with USAC as the National Verifier, that's a perfect example of where we really are seeking your guidance and your advice to make sure that we do a really good job with this in reaching the communities that you're working in, the tribal nations, and working with them in a way that makes the most sense. And so I think languages is a great example of that. To the extent that there are other considerations that might be unique to different geographic areas or different tribal nations that we should be aware of, we really do seek your advice in that way, so that as we continue to promote the Lifeline program, we're able to make information available and make processes really easy to use. So we're eager to hear from any of you that might have ideas or advice about that. We're also eager to learn how we might work more with the tribal qualifying programs that Nate mentioned, Tribal TANF, Head Start, the Bureau of Indian Affairs General Assistance, for example, how we can coordinate with those programs in order to better serve tribal subscribers who may be interested and have a need for this important discount to connect to their communities and to other services. So I would just sort of leave you all with the thought that we're eager to continue to work with you so that we can make this program as effective as possible at assisting tribal subscribers.
All right, thank you. And we did have one additional question that came in. If eligibility is based on income, so 3 consecutive months of income that need to be verified?
I feel like the question broke up a little bit, but it sounds like the question is about how income is verified. Did I understand you correctly?
Yeah.
So there's no rule that indicates a certain number of months of income must be verified. The income eligibility rules are based on, at the time of enrollment, how much income somebody has. So it's not as though the rules lay out a period of months, but I'm sorry, it is specified? I apologize. I am misspeaking, and all of my trusted advisors here are flashing their arms at me. Could you please advise me if you can either answer?
This is Ryan. Ryan Moxon. I'm an analyst with the Lifeline Program. The rules do go into some detail as far as what acceptable documentation of income is, and I think, and this is more at the 90% level, it's the preceding 3-month period is what carriers, if they don't have a full year to look at, there's a 3-month period that they can look at as well.
Okay, great. So should we confirm that and get that back to the group? Okay, so thank you so much, Ryan. I'm glad you were here, and I apologize for giving you that information. So we'll make sure we turn that back around to you with 100% confidence, but it sounds like, yes, there's a number of months and guidance in the rules about that.
All right, thank you. Not seeing any additional questions right now, so I think this is a good part to go ahead and conclude. I just want to remind everyone that this webinar was recorded and it will be uploaded and placed on NCAI's website and YouTube channel. I will also send a follow-up email to you all with a copy of the presentation and a link to the presentation recording. And I will also be sure to share that information with you at USAC as well, so that you can do some follow-up to some of the questions that were asked today. And just want to thank everyone for attending today and participating. Did you guys want to offer any closing remarks?
I just want to thank you again, to echo Jessica and Nate's earlier comments about giving us the opportunity to engage with you today, and thank you so much.
And I just want to follow up on Michelle's comment that it's really a new shift for the Universal Service Administrative Company to really make this program and really open up the channels of communication in Indian country. We want to really truly integrate and possibly conduct consultation to the extent we can learn from Native communities on how best to make this $30 to $4.25 subsidy as widely available to all those who are eligible. We, as I said earlier, this is not the first time, and it won't be the last that we speak to all of you. We want to be visible, and so I think we'll hopefully participate in future NCAI events to really meet with all of you and learn about some of the challenges that you're facing in meeting your broadband connection and digital opportunity goals.